This is the High School Crossfire. Welcome back.
Dear ladies and gentlemen, when Team Negative brings the One Health program, Team Affirmative is not against the One Health program, and it's actually the reason as to why we would solely blame this government for actually not having implemented this One Health program before antimicrobial resistance actually developed in the country. Ladies and gentlemen, Team Negative comes and tells us that our just parameters are not justified, but our first speaker emphasized this right from his very first speech. He said that the point of global antimicrobial resistance is the global problem, and we agree. But in other countries, it's common in low developing countries, and these low developing countries, they are countries where it is actually not solely because of the government. And this is where our house as the World Health Organization, which they did not also hear, came and actually pointed out Uganda. Because in Uganda, it is the government and health sector to solely blame. This is why we identified Uganda as the parameter for today's debate. That means we still stand on our parameters. Because Uganda, the Ugandan government and health sector is actually solely to blame in this. My name is Mubri John Bosco from Namilyango College, and I'm the second affirmative in today's debate. Now, what are we going to talk about? They come and tell us the agriculture sector is to also be blamed, and then they add another factor, the general public. But what do we tell them? That the agriculture sector actually has a health sector in it. What is the health sector in the agriculture sector? We have the veterinary medicine. These fall under the health sector. Therefore, not all the agriculture sector or farmers are involved in the actual use of the drugs. Therefore, there is a point, there is a mistake that someone has failed to do in the health sector that is actually causing the leakage of drugs poorly in the agriculture sector. And this is why we regard them, the rest of the part of the agriculture sector that is not part of the veterinary medicine, as the general public. Now, we go on to our case. Panel, we have quite very many points. Now, number one, why are the reasons as to why we solely blame the government? You realize there's inappropriate prescription practices. And who does this prescription? It's health workers. Now, a case in Sunday, we shall consider the Observer of October 15, 2016, where in Kasangati Health Center 4, actually, someone employed in the government health facility prescribed expired medicine to a patient. And the patient actually got to know this, that the expiry date was actually August 2016, but he was given the medicine in actually October. Now, what happens when you give me medicine that was expired in August and you give it to me in October? This means you're actually increasing chances for antimicrobial to actually occur. Why should the health practitioner actually involve in such activities? We are there to solely blame because of this. Then we look at inadequate patient education. Yes, granted.
What's the matter of urgency in this debate?
The matter of urgency in this debate is actually to identify who has gone wrong in the antimicrobial resistance so that they can actually solve it. And it's what we are trying to show the government, that they are the ones to blame, and they had things they are supposed to do, but they did not do them, and this is why we are blaming them. Then we talk of the inadequate patient education. Who's supposed to do the education on the patients? That take your dose 2 times 3, 7 times for 7 days. Why should you stop taking the medicine at 3 days? Because you have not been sensitized by the government and health sector. You're supposed to do this. Then number 3, we're talking of the limited diagnostic facilities. By 2017, we only had 25 human health facilities that were actually doing regular antimicrobial successfully testing. 25 facilities are catering for the 44 million people in Uganda. Now, ladies and gentlemen, what does this? That is according to the statistics from the population census of 2014 and of 2017. 25 health facilities catering for over 44 million people. This is insufficient. With a doctor ratio of 1 to 25,000, according to NCBI.gov. Ladies and gentlemen, this cannot be effective. Then we talk of the lack of appropriate functioning drug regulatory mechanisms. What do we mean by this mechanism? In 2014, the government actually introduced a policy of test before you prescribe policy. And this policy was not actually followed up. You realize that anyone in Uganda can actually access drugs anywhere, anyhow, without actually prescription. Someone accesses the drug shop, gets my medicine without having gone and undergone any testing and any prescription, simply because they are feeling fever. And this medication is the cause of the government. There is poor sensitization, like we told you. Look at the response the government gave to issues like COVID-19. You have realized during COVID-19, within 1 month, everyone was aware about COVID-19. But the government actually undervalued the point of antimicrobial resistance. They said that we had a decade for them to actually come out and show that there was actually antimicrobial resistance. In 2013, a case studies the ARV that were presented to the parliament, actually, that was on Wednesday 8th this month. Now, what did they say? They said that actually knew this from 2013. We are in 2023. They have actually not even come out to sensitize, but they are just reporting the issue to the parliament. What does this mean? That sensitization has not been there, and the people cannot be blamed in this. But the government is actually playing the actual role in this. The non-human use of antimicrobials. Now, who tells the farmers that you're supposed to use this for the fattening of animals? It is actually these professionals, because these professionals should have more knowledge about these antimicrobials. This is how the medicine actually leaks. The leakage also shows an incompetence in the government's case. I rest my case.
What the team affirmative is putting forward in this debate is the law of the minimis non-cura lex, where small things matter less. But for us today, we want to tackle the issue that is killing 1.27 million people globally, ladies and gentlemen. Notice that they come here and they tell us that their parameter is Uganda, but we see that this is a global issue that is killing people all around the world. If they're to corner themselves in Uganda, how are you solving the issue in other countries around the world, ladies and gentlemen? We asked them what the matter of urgency was, and they tell us that identifying who has gone wrong, but they don't tell us how they're going to do, what they're going to do after identifying who has done wrong. They did not give us a work plan. Dear judges, take note of that. They did not give us a body that they're going to work with. They're simply coming to state things that they don't understand, ladies and gentlemen. My name is Griffin from St.Lawrence Academy Schools and Colleges, here to negate this motion, ladies and gentlemen. To truly address the dire challenge of antimicrobial resistance, we must resist the temptation to assign all the blame to the government and the health sector. This complex issue touches lives of every individual, transcends borders, and involves various stakeholders. In this debate, we advocate for a more balanced perspective that recognizes shared responsibilities. Ladies and gentlemen, let's not overlook the fact that in this complex battle against antimicrobial, please calm down. In this complex battle against antimicrobial resistance, the path to success lies in embracing the principle of effective shared responsibility within the framework of One Health approach. Ladies and gentlemen, we must recognize that this engages individuals, healthcare professionals, policymakers, the agricultural sector, and the broader economy, all working in harmony under the One Health approach. It is only when we shoulder our part responsibility in a coordinated manner that we can truly strive in addressing the global challenge. I would like to stress the significance that the government has endeavored to do the following: invested in many research centers to increase the collection of data and aid surveillance. They come and they tell us that the government has not done much in collecting, in addressing in terms of research centers. But we tell you that, Pano, just in Uganda, we see that the government has invested so much in research micros through through trying to incorporate the country's leading university, Makerere University, into a research-based institution according to idi.mak.ac.ug. And research says that it's not the only one because we see that other universities like Chambogo and Mbara are also being brought up. So that point of view, the government not bringing in research centers, they're not standing anywhere. We see that these research centers aim at controlling AMR by fighting infection rates 17% by the end of each year. Where are we aiding? We are aiding at ending AMR. Furthermore, we still see that these centers have trained many medical personnel in areas of HIV/AIDS, malaria research, and many more. According to ox.ac.ug, about 55,000 individuals are trained each year. And they come here and they tell us that the country is actually lacking personnel that are prescribing drugs wrongly. We see 55,000 people being trained each year. Ladies and gentlemen, World Health Organization compliments that Uganda is the first African country to implement a structured national surveillance program in alignment with the World Health Organization. And they come here to blame the government of Uganda, cornering themselves in Uganda. We see that the government and the health sector is actually playing their role in ensuring a robust national action plan to tackle antibiotic resistance that is in place. This is a critical point to remember, ladies and gentlemen. The government has carried out constant campaigns with its collaborators, quote me well, with its collaborators, not just alone, but with its collaborators like World Health Organization and NDA, through the talk shows, adverts, and radio stations. That's why we as small farmers come and tell you that we say it would be better to blame the agricultural sector. Why? Because research says that in 2016, the General Assembly of United Nations recognized inappropriate antimicrobial use in livestock as one of the leading causes of increasing antimicrobial resistance. 66% of antimicrobics are being used in farm animals, according to research from SaveOurAntibiotics.org. We see that this percentage is very high given compared to the one the human beings are saying. But we are not here to play the blame game. We are here to advocate for a collaborative effort. It's worth highlighting that our parameter being the world, me and you can best illustrate how much the government and the health sector has done. I choose to speak about Uganda to best illustrate because this research says from World Health Organization that Uganda is one of the countries that is highly battling AMR. We see that the government has including ways like prevention of infections, giving out nets to fight malaria. So we see that the government is trying to fight this from the root cause, ladies and gentlemen. We must not forget this. I am so proud to negate this motion. Thank you.
This is the High School Crossfire. We'll be back in a minute.